Homelessness, a problem that affects all aspects of society. In Santa Barbara, the issues surrounding homelessness ripple into our community's ability to provide not only basic services to those most in need, but also to the community at large.
There are people that are homeless or soon to be homeless are trapped in a reoccurring state of either mental illness and or drug dependency. And we get called when they're involved in some nuisance-related problem resulting in negative police contact. 10% of the people we deal with are 90% of the problem. They draw the biggest draw on our community. They take up ambulance services, they take up first responder services, they take up bed.
To address these problems, the police department establishes personal contact with the goal of breaking the cycle of citation, incarceration, and addiction.
In July of 2011, City Council decided to augment or enhance our efforts towards restorative policing, which is really trying to restore people a life of dignity, those who have found themselves living on the streets, many of whom are involved in the criminal justice system. And through our efforts to try to house them, they're constantly kind of being recycled through the system. So our restorative policing efforts are to try to help those people regain a life of dignity and get them off the streets in a sober living facility.
To enhance restorative policing efforts, community service liaisons were brought in to act as an extra set of eyes and ears on the street, identifying problem areas and hearing from people in the community that are most affected by this issue, and then relaying that information to police officers.
We felt that we brought in some civilian help, non-sworn people, non-cop people, to assist us with transporting, counseling, and all those other things that the officers get caught up in and then are off the field. We felt that this would allow us to stay in the field and still get the job done. And also, some of these folks, quite a few, they don't trust the cops sometimes, and they would rather speak to someone who is not in uniform, even though they're performing the exact same assignment or help for them. We're trying to build that relationship up, and a lot of them love the cops because we do help them, but some don't, and they would rather speak to a person who isn't a police officer, and we understand that, and we felt it was important to put folks out there that aren't cops, that are really seen by the client as this person is going to help me today.
For Nick Ferreira, homelessness was never something he believed could happen to him.
I came down with a medical condition that caused me to have horrendous headaches, double vision, crossed eyes, and I was not able to work anymore. I was placed in the position of basically just getting by day to day because of this medical condition. In the meantime, I also became addicted to the pain medications I was given for the problem. And so I lost everything. I lost my home, I lost my family, my child.
None of these people really prefer to be living like that. There are just so many things that have gone wrong along the way, so many missteps, so many wrong turns, that it's difficult for them to unravel it.
Through Santa Barbara's restorative policing efforts, the police department, court system, healthcare system, and social service agencies collaborate to get individuals off the streets by providing transitional housing, creating stability, and directing people to services they need.
Restorative policing, what that does is it allows us to identify these folks as human beings and identify some of their needs. Many of our officers, almost all of them, have been trained in what we call crisis intervention training for the officers to identify early mental illness. Doesn't make them an expert, but it gives the patrol officers, especially those officers who are not assigned to full-time restorative policing, that when they're on a call for service, they can also see mental illness.
What's the holdup with that? Is it money?
Restorative court is another tool that allows officers to develop customized recovery plans based on the needs of each individual.
Typically what will happen is someone will be arrested for drunk and disorderly and will wake up in jail and decide that they're done with that and they want to change their life. And their attorney or Officer Hove will admit them into the restorative court, and then they are committed. They have to sign an agreement to stay with us They have to sign an agreement that says they'll follow the case management plan, and the case management plan will be designed to deal with any substance abuse issues, mental health issues, and get them into stable housing.
The program has helped many individuals gain control of their life once again.
Were you part of restorative court?
Yeah.
And tell me about restorative court.
You got to show up whenever they give you on Wednesday at 11. You have to show up and see the judge, and I had a public defender, and I was doing it once a week, and then it was every other week, and then it was like once a month. So it paid off. I got through it all.
Do you think you're better with restorative court or worse with restorative court?
It was good.
It was a good thing?
Yeah.
And what's your...
I haven't got any tickets since I've been sober, so...
That's what it's all about. And before, you had a lot of police contact, right? Before?
Well, because I was homeless and living in the park.
In the park. So with restorative court and where you are now, is your quality of life is improved?
It has, yeah. I don't miss drinking one bit.
That's huge.
Yeah.
The nature of addiction is that when you have people that have been abusing substances for 30 years, they're probably not going to make it their first try. And all that we ask is that they keep working with us and that they keep trying. And we have a man in right now that's probably on his 4th try, but he still wants to do it, and he is still willing to try, so we're willing to work with him.
Without encouragement, support, and a personal desire to change, people will almost always fall back into their old patterns.
If they fail to complete the program as it's described for them, we send them back to the Alpha Court. That means they had several months to do the right thing, and they choose at some point to go, you know what, this is not worth it to me. I'd rather just go back and do my terminal disposition, meaning I'll go spend 2 weeks in jail. I discourage them from doing that if we're in the process of working on something that's helpful, because on the other side of those 2 weeks, they're going to come back out at the back door of jail at 2 o'clock in the morning and go back to the same lifestyle again.
Aware of the homeless issue in Santa Barbara, over 500 concerned citizens canvassed the streets and surveyed the homeless to get accurate data as to how many are on the streets and what challenges they are facing.
We treat them like people, getting to know them. It's not just an interview, it's a conversation. A lot of the people just really appreciated someone to talk to instead of being looked over or being passed. I hope we break down the stereotypes. I hope we see them as humans and that we see their needs as they're able to be met.
Of the 754 homeless people who took the survey, 76% had been to jail, resulting in a cost of approximately $9.9 million. In addition to the large price tag for incarceration, booking the homeless in jail impacts the current overcrowding of our jail system.
We do have a lot of the same people coming in. Anecdotally, about 80% of the people that we book here have been booked here before, or we have some sort of prior relationship with them. We actually release them pretty quickly. All misdemeanors we release on a citation to appear, which is like a ticket to go to court. So we don't really have the room in our jail to house very short-term, low-level offenders. That's because we don't have the jail space.
Aggressive panhandling, public intoxication, and other nuisance-related crimes by homeless people have a significant impact on the economic health of our local businesses. In addition to prisons, businesses, and police services, emergency rooms and healthcare services are also heavily affected by this issue.
If an individual doesn't have the funding, then some of the channels or some of the pathways that would be followed on that is that we can look for or try to assist in getting funding for them through Medi-Cal applications or helping and assisting them with a Medi-Cal application or with other government or local type funding such as the Medically Indigent Adult Funding, MIA, or if there's no linkage or connection to any of those, then we assist them with our own cottage charity application, so charity funds that would come through the foundation.
In the last year, Cottage Hospital had 220 emergency room visits and 290 hospitalizations of homeless individuals, costing approximately $2 million.
If you don't have a regular care provider and if you don't have regular resources to medications, then that'll cause a breakdown in preventive health and subsequently can cause disastrous situations which will lead to hospitalizations.
The more services that can be delivered to the homeless in an efficient and cost-effective manner, the more time is freed up for better customer service to the entire community.
Our ultimate goal is to reduce calls for service for our first responders, police, fire, paramedics. We want to reduce the amount of beds that are used at Cottage Hospital and out at County Jail. In doing so, there's a huge cost savings that the community will recognize. It's not an easy process, and it's not always timely. And simply because we're never in charge of when somebody makes the decision to change their lifestyle. But being omnipresent in the community, always being available when they are ready, is what's making our program really helpful.
I personally believe that everybody should have an opportunity to reach their full potential. Homeless people are marginalized. Even after they get housed, in many ways they're marginalized. And that's one new avenue of change I think that needs to be explored, is the opportunity for everybody to reach their full potential.